It is not possible to definitively diagnose David Miscavige with any mental illnesses or disorders without a formal psychological evaluation by a qualified professional. However, based on reported behaviors attributed to him, particularly from former Scientologists, journalists, and critics, some patterns have been speculated upon. These behaviors are often linked to traits that could potentially align with certain personality disorders, though it is crucial to remember that this is conjecture and not based on clinical evaluation. Here's a speculative list of mental illnesses or disorders that could be associated with behaviors attributed to Miscavige. 1. Narcissistic personality disorder, NPD. Grandiose sense of self-importance, preoccupation with power and control, lack of empathy for others, need for excessive admiration, reports of aggressive or abusive behavior toward subordinates. 2. Antisocial personality disorder, ASPD. Disregard for the rights and feelings of others, manipulative and deceitful behaviors, impulsivity and aggression, lack of remorse for harmful actions. 3. Paranoid personality disorder, pervasive distrust and suspicion of others, interpreting benign remarks or actions as threats, preoccupation with loyalty and control within the organization. 4. Obsessive-compulsive personality disorder, OCPD, preoccupation with order, rules, and control, perfectionism that interferes with task completion, rigidity and stubbornness in decision-making, excessive devotion to work at the expense of relationships. 5. Intermittent explosive disorder, IED, repeated episodes of impulsive, aggressive, violent behavior, overreaction to perceived slights or minor provocations. 6. Sadistic personality traits, though no longer classified as a distinct disorder in the DSM, deriving pleasure or satisfaction from the suffering of others. Cruel and demeaning behavior. Reports from former church members of abusive practices. This list is speculative and based on patterns of behavior reported by former members and critics of Scientology. It is important to emphasize that any diagnosis of mental illness would require a thorough and objective assessment by a mental health professional.